Have you ever heard of a drug called Probenecid? Yeah, probably not. But its story is one of the most fascinating in all of medicine. A drug invented for one reason during a world war that we now use for something completely different. It's really a perfect lesson in how scientific discovery can be so unpredictable.
The reason we're even talking about this drug today has almost nothing to do with why it was first created. It's a classic case of scientific serendipity, a happy accident. It's a journey where the search for one solution accidentally uncovered another equally valuable one.
So that's the big question we're tackling. How did a secret military project from the 1940s end up in a modern pharmacy as a treatment for something totally unrelated, like gout? Let's follow that trail and uncover this drug's remarkable double life.
Our story starts where so many tales of innovation do, in a time of crisis. The world is at war and necessity is pushing science forward at an absolutely breakneck pace.
Okay, so picture this. It's the 1940s. Penicillin is the new wonder drug and it's saving countless lives from infection. But there was this huge problem. It was incredibly hard to make and in very, very short supply. Doctors had to make every single dose last as long as humanly possible.
So scientists were given a very specific and pretty clever mission. They had to find a companion drug, a blocker, that could basically tell the kidneys, hey, hold on to that penicillin. Don't get rid of it so fast. The goal was simple. Keep penicillin levels higher in the blood for longer, making each precious dose way more effective. And that mission, it led to the creation of Probenecid.
And you know what? Probenecid was a huge success. It did exactly what it was designed to do. But as scientists were studying its effects, they noticed something unexpected. In solving one problem, they had accidentally stumbled upon the solution to a completely different one. This is where the story takes a sharp turn. While they were monitoring patients, scientists saw something strange in their lab results, something that had nothing to do with penicillin. The drug was having this powerful, unforeseen effect on a common waste product in the blood, uric acid. They had discovered its powerful Uricosuric effect. Now, I know that sounds super technical, but what it means is actually pretty simple. Probenecid was forcing the kidneys to flush huge amounts of uric acid out in the urine. This dramatically lowered the amount left circulating in the blood.
And this was a massive breakthrough. Why? Because high uric acid is the direct cause of gout, a form of inflammatory arthritis where these sharp needle-right crystals form in the joints, causing just excruciating pain. Suddenly, this penicillin booster had a brand new identity as a potential gout treatment.
So how can one drug do two completely different things? Well, the secret lies in how it interacts with the incredibly sophisticated filtering system in our kidneys.
Let's imagine your kidney is a recycling plant. After uric acid is filtered out of the blood, a transporter called URAT1 normally pulls most of it right back in. Think of it as recycling. Probenecid acts like a foreman who steps in and blocks that transporter, basically telling it, nope, leave that there. And the result? All that uric acid gets trapped in the urine and is flushed out of the body for good.
And this just illustrates the drug's two functions so well. As an antibiotic booster, it blocks the pathway that pushes drugs out of the blood. But as a gout fighter, it blocks a different pathway that pulls uric acid back in. It's all about blocking different doors in the kidney to get two very different, almost opposite-sounding results.
So, that's the fascinating history. But how is this drug actually used today? Let's take a look at the modern user's guide. Its primary job today is the long-term prevention of chronic gout. And this is so critical. It is not an emergency painkiller for a painful attack that's already happening. While it's often a second-line therapy, it's still a vital option. And yeah, it's still occasionally used for its original purpose, to give certain antibiotics a boost in tough infections.
If there is one thing to take away about using this drug safely, it's this number. Patients on Probenecid must drink plenty of fluids. We're talking at least 2 to 3 liters every single day. This is non-negotiable. Because you're flushing so much uric acid out, you have to keep it diluted to prevent it from forming painful kidney stones.
Now, here's a fascinating paradox for you. When you first start taking a drug designed to prevent gout attacks, it can actually trigger one. I know, it sounds completely backward, but there's a really good reason for it.
So what's happening is the drug suddenly starts pulling all these long settled uric acid crystals out of the body's tissues. This rapid movement can create a sort of traffic jam in the joints, which then leads to inflammation and a flare-up. This is exactly why doctors start patients on a very low dose and often have them take an anti-inflammatory for the first few months. Because it works on the kidney's filtering system, probenecid can interact with a lot of other drugs. For instance, something as common as low-dose aspirin can actually cancel out its benefits for gout. But the most dangerous interaction is with methotrexate, where probenecid can cause levels to become toxic. This is why it is absolutely crucial to tell your doctor every single medication you're taking.
And finally, it's not for everyone. As you can see, it shouldn't be used if you have severe kidney issues or a history of kidney stones. And, as we've emphasized, it should never be started during an acute gout attack.
So, when we put it all together, what is the lasting story of this incredible drug?
Probenecid is a perfect capsule history of medical progress. It started as this ingenious solution to a wartime crisis, and then through really careful observation, it evolved into a treatment for a chronic painful disease. It reminds us that sometimes the most important discoveries are the ones you weren't even looking for.
And that leaves us with a final thought. Probenecid's story is such a powerful reminder to stay curious. It really makes you wonder what other secrets are hiding in plain sight in our medicine cabinets, just waiting for a sharp-eyed scientist to notice. What's going to be the next accidental discovery? Thanks for joining this explainer.